Dr. Nyberg, at the Medical Chambers Kensington, you offer different types of blood tests for testing for chromosome abnormality during pregnancy. How does the patient make a choice? Do you recommend a particular test, or does the patient choose the test they want?
Well, we're oftentimes asked what tests are available and what tests will we recommend. And the answer to the second question is the test that's always the best test is the one that the patient chooses. So as long as the patient is well informed, she'll always make the best choice for her and her family and her future baby. So our job is to really get the most information to the patient and let her choose. We do offer various tests, and especially for the what's called the non-invasive prenatal test, or NIPT, which is the revolutionary test looking specifically for fetal DNA in the maternal circulation, and looks for chromosome abnormalities like Down syndrome. We offer three kinds of tests at the clinic here. The first one is what I'd call a basic NIPT test, which is like the Harmony test, and that really tests for the major chromosome abnormalities. Trisomy 21 or Down syndrome is the most common chromosome abnormality, and of course it tests for that. So all of the NIPT tests are very accurate for testing for Down syndrome. The second test that we offer is a bit above that. It tests for the same things plus selected microdeletions. And microdeletions can get a little complicated, but they're smaller bits of chromosome abnormalities. And there are some important ones in there, some not uncommon ones, like Q22 deletion, which is associated with DiGeorge syndrome. And again, all patients have some risk for that. That is not dependent on age.
Right.
And fortunately, the risk is small. It's about it's about 1 in 3,000. But again, all patients are at risk for that. Most of those, many of those will show heart defects on ultrasound, maybe in half the cases, but about half won't be recognized. Right. The third tier is what we offer is the most comprehensive test, which is what we call, or is called the genome test, at least by the laboratory. And that tests for all parts of all chromosomes. So if you think of the chromosomes as a circle, the basic NIPT will select certain parts of that to test. The intermediate test will test for a few more chromosome abnormalities, but the genome tests for the entire circle, all parts of all chromosomes. So the accuracy should be similar to a CVS. The advantage is that it's going to detect other types of chromosome abnormalities that are less common. Individually, they're not very common at all, but together as a group, it represents about 20 to 25% of all the chromosome abnormalities. So theoretically, the genome test should pick up 20 to 25% more chromosome abnormalities, and the data so far looks to support that.
Mm-hmm. But does any of those tests tell you 100% yes, your baby has this abnormality, or no, everything is absolutely fine? Is it 100%?
Well, it's not 100%, but there aren't many tests that are 100%. It's very close to that. It certainly seems to be as accurate as chorionic villus sampling. So if we get a positive result, we'd like to confirm that. But fortunately, of course, we usually get a negative result. And it's normal, and it shows us that it's normal, and it's very accurate for that. So it's not 100%, but it's very close to that. We'd like to confirm that by again looking and making sure the ultrasound looks normal, both at the 12-week scan and at the 20-week scan. But a normal result is very, very reassuring.
And if you have a test that tests for everything, why would you not choose that one above a basic test or an intermediate?
Well, the genome test, the one that tests for everything, obviously is the most comprehensive test, but it's also is much more intensive for the laboratory, and therefore it's more expensive. So the real trade-off is the thoroughness of the test. It's like using a stronger and stronger magnifying glass or a microscope, has more expensive microscope, and they have to take more time to look at the detail. And because of that, the lab is more expensive for the lab and they charge more. Our costs are not any different, but the labs are. So for the patients, it's a trade-off between cost and what information they'd like to know. For some patients, just knowing that the basic major chromosome abnormalities like Down syndrome, that test is normal, is good enough for them. And in fact, for many people, many patients. Other patients would like to have more information and might choose the intermediate test, and of course some patients choose the comprehensive test.
Right. Dr. Nyberg, thank you very much.
Thank you.